Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Subatra Lahri. I am Director Cardiology in Artemis Cardiac Care. And today I'm telling you about the 5 essential insights on heart failure. And we understand that in a country like ours, we are grappling with heart failure. And this is surprisingly very common in young individuals. Unlike in the West, where it is seen more commonly in elderly population, in our country, heart failure patients are seen majority in the younger population. Now, let us break down some 5 essential insights on heart failure. First, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think that it is the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction is a parameter which measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, that is the ventricles, each time it contracts. While a normal ejection fraction, which is normally called as EF, is around 50 to 70%, individuals with heart failure typically have EF of 30% or lower. Secondly, why are so many Indians affected by heart failure? Genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen these epidemics. Moving on, what are the signs and symptoms of heart failure? Watch out for confusion, fatigue, heart palpitation, nausea, shortness of breath. Some people will get chest pain as well if it is associated with a blood vessel blockage. In some cases, we do. And there will be loss of appetite or vomiting and abdominal fullness, which is often called as early satiety. How can we protect ourselves from this disease? Our heart works incredibly hard to keep us alive. These are the 5 golden rules that we can follow to return the favor. Early detection of heart failure through regular blood tests, dietary adjustments to maintain healthy heart, and incorporating daily exercises into routine practice. Practicing stress management techniques goes in a long way in maintaining your heart function. Quitting alcohol, tobacco, smoking, and other bad habits will help the heart in regaining function. Lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. In today's era, there are a good number of drugs that have been formulated or invented, which can really improve the cardiac function, heart function, ejection fraction. When there is the congestion in the lungs because of heart failure, where there is water retention, one needs therapies like diuretics, and there are other drugs which will help in improving the heart function. Devices like biventricular pacemaker, implantable cardiac defibrillator, and heart repair or replacement wherever required should be done. Patients with coronary artery disease should get angioplasty or bypass surgery, which might improve the heart ejection fraction and heart failure. When the other therapies exhaust, there is a treatment and option for heart transplantation. The lifetime risk for congestive heart failure is 1 in 5. 25% of the patients with heart failure, they demise at the end of 1 year. And this probably is going to change over a period of time when we have better therapies which are already available, and one should resort to treatment as early as possible. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.